In planning full arch implant treatment, in some cases in the upper jaw, we may need to manage or overcome enlarged sinus spaces that limit the amount of bone available for standard implants. When upper back teeth are lost, bone atrophy occurs not only from the outside but also from inside of the sinus, especially in patients who have worn dentures for many years or have experienced severe infections or advanced gum disease. As the bone shrinks, there may no longer be enough height or strength beneath the sinus to safely or securely place standard dental implants. When this happens, conventional implant treatment may no longer be possible without a more advanced solution. Pterygoid implants are an advanced solution placed at the very back of the upper jaw at an appropriate angle to bypass areas of poor bone and sinus spaces, anchoring securely into the dense medial pterygoid bone plate behind the upper jaw. The density of the pterygoid bone plate is typically very high, which helps stabilize the implants even in very poor jawbone. Pterygoid implants are placed from inside the mouth and are typically combined with regular implants in the front part of the jaw. They may also be used with zygomatic implants for additional posterior anchorage when required, such as in patients with a very heavy bite. The position of pterygoid implants in the very back can sometimes be difficult to access for cleaning for some patients, so it is reserved for specific situations when it is absolutely needed.